Hi, I'm Dr. Pamela Morris. I'm professor of medicine and cardiology at the Medical University of South Carolina in Charleston, South Carolina. The title of my presentation today is Lifestyle Interventions to Reduce Cardiovascular Risk, or as I like to say, a little less drug, a few more vegetables, and a lot more rock and roll. So let's see. About this. Okay, great. So these are my declarations of interest, as you can see here. Now, one of the things that I find is with guidelines across the globe is that we do a very poor job of implementing evidence-based guidelines. And some of the reasons for these controversies are based on discordances between the guidelines and a misunderstanding of some of the differences between recommendations. And I thought what might be fun to do today is to take an opportunity to look at the remarkable concordances and agreements between the guidelines for cardiovascular disease prevention and lifestyle from the ACC-AHA, but also compare this to the European guidelines. Now, the first thing that both guidelines agree on completely is the importance of a multidisciplinary care team to implement lifestyle interventions. This is a Class 1A recommendation for the ACC-AHA, recommending a team-based approach, and also a multidisciplinary healthcare professional recommendation at a Class 1A recommendation in the European guidelines as well. So utilizing our registered dietitian nutritionists, our nursing staff, our exercise physiologists, our psychology team members to help us with modification of lifestyle and adherence to lifestyle recommendations. Another important aspect of both guidelines is the recommendation for shared decision-making. And the US guidelines have a level B1, level 1BR recommendation for shared decision-making to reduce cardiovascular risk. You can see below in the second graph that there are some very specific recommendations from the European Society of Cardiology, trying to better understand the patient's preferences, choices, and priorities. So again, excellent concordance of recommendations. Now, moving on to dietary interventions. 1 out of every 5 deaths in 2017 were associated with poor diet, according to the Global Burden of Disease study. Cardiovascular disease was the leading cause of diet-related deaths around the world. Now, the 2019 guidelines from the US recommend a diet that emphasizes intake of vegetables, fruits, legumes, nuts, whole grains, and fish, replacing saturated fat with dietary monounsaturated and polyunsaturated fats, and reducing the dietary content of both cholesterol and sodium, minimize the intake of processed meats, refined carbohydrates, and particularly sweetened beverages, and really limiting or omitting the intake of trans fats. Now, one of the things that's slightly different with the European and the ACC-AHA guidelines are that there are more specific numbers or for daily consumption in the European guidelines, so less than 5 grams of salt per day, trans fats as little as possible, specific amounts of fiber, fruits, vegetables, and fish. So again, similar recommendations, but more quantity specific in the European guidelines. Now, moving on to physical activity, this is some data from the US. Only about 1 out of every 5 Americans meet the minimum physical activity recommendations. This was data from 2015. And You can see here that on average, adults typically spend more than 7 hours per day in sedentary activities. Now, given some of the European cities or cities in other worlds that may be more walkable, these numbers may be a little bit better in other cities, but certainly not ideal in the US. Now, the recommendations for physical activity, both in the US guidelines as well as in the European guidelines, are almost identical. To recommendations class 1B and R for at least 150 minutes per week of moderate intensity exercise or 75 minutes of vigorous intensity exercise, and engaging in any amount of physical activity is better than engaging in no physical activity. The European guidelines are very similar, if not identical. Again, a class 1A recommendation for 150 minutes of moderate intensity exercise or 75 minutes of vigorous exercise for both guidelines. Now, there are both guidelines provide tables to help in terms of knowing what moderate and vigorous activity look like. Here you can see from the US guidelines light, moderate, and vigorous, and descriptions of the types of activities that fit these categories. Now, one of the differences in the European guidelines, which I like very much, are that they also include recommendations for relative intensity. So for the percent of heart rate max, the Borg perceived exertion scale, as well as the talk test. And I find this table to be particularly helpful when counseling patients. Now, in terms of maintaining and achieving a healthy weight, this oftentimes requires a comprehensive lifestyle program. And usually you should consider that this be at least for 6 months to really achieve the desired weight loss with behavioral support as well, reducing caloric intake by at least 800 to 1,500 kilocalories per day, increasing physical activity, as we've already discussed, and then being sure to carefully monitor the weight, the BMI, as well as the waist circumference. Here from the US guidelines, just really in table form, these are all level 1 recommendations, class 1 recommendations, level 2A for monitoring waist circumference. The European guidelines are similar, that patients should achieve an ideal body weight, monitoring waist circumference and BMI. This is a class 1A recommendation. Now, it's important to recognize that lifestyle intervention is also critical for controlling risk factors for cardiovascular disease, and lifestyle intervention is recommended in all guidelines for management of risk factors. Here for management of type 2 diabetes, the US recommends a Mediterranean DASH or a plant-based diet, either vegetarian or vegan. And again, an emphasis on exercise, including both aerobic and resistance exercise to achieve those goals. These are from the European guidelines for management of diabetes, with a class 1 recommendation for lifestyle intervention for improved glycemic control and control of risk factors. When looking at management of lipid disorders, the 2018 AHA-ACC cholesterol guidelines for primary prevention in particular here, always an emphasis and serving as the foundation are adherence to a healthy lifestyle. The European guidelines have a beautiful table looking at all levels of cardiovascular risk by the SCORE algorithm and at all levels of LDL cholesterol. You can see that lifestyle intervention is absolutely foundational, and that pharmacology or pharmacological therapy is implemented at higher levels of risk and at higher levels of LDL cholesterol, but that is added on the top of lifestyle intervention, as we've discussed. Lifestyle intervention is also pivotal for the control of hypertension. This graph is actually from the U.S. Hypertension Guidelines and shows that a heart-healthy lifestyle and intensive lifestyle modification is indicated at all levels of blood pressure and all levels of cardiovascular risk. On the other hand, in the setting of low risk, when patients have systolic and diastolic blood pressures of greater than or equal to 140 over 90, you may consider the addition of pharmacotherapy. And in higher risk patients, pharmacotherapy may be considered at blood pressures 130 over 80 and greater. Now, for the European guidelines, here you can see that lifestyle measures also have a class 1A recommendation for management of hypertension, again, focusing on sodium restriction, maintaining ideal body weight, and increased physical activity. Now, for tobacco cessation, the non-pharmacological recommendations include lifestyle intervention. Tobacco's use assessment is really important and is your fifth vital sign, so be sure to include that in every physical exam. Recommendations for avoiding secondhand smoke, and it is recommended that for most patients for successful tobacco cessation, it will require not only lifestyle intervention, but likely pharmacotherapy. There are a number of options for tobacco cessation, including nicotine replacement therapy in a variety of forms, as well as therapy with bupropion or varenicline. So as you can see that for really optimal cardiovascular risk reduction, lifestyle intervention is foundational in really in global guidelines, but today we've really taken a look at the comparisons between the US guidelines and the European Society of Cardiology guidelines. Tremendous concordance, and I encourage all of you to implement lifestyle intervention in your daily practice, and be sure to inquire at all clinic visits about patients' adherence to these recommendations. And with that, I'd like to thank you.